Good day, everyone. Today, we will be discussing lymphedema, a chronic condition characterized by the abnormal accumulation of lymph fluid in the tissues, resulting in swelling of one or more body regions. First, we have the lymphatic systems and the lymphedema. The lymphatic system plays a vital role in maintaining fluid balance, supporting immune function, and removing waste products from the body. When these systems becomes damaged or does not function properly, lymph fluid accumulates in the tissues, causing swelling, also known as lymphedema. Lymphedema is important in rehabilitation because it can significantly affect mobility, function, comfort, and quality of life. If left untreated, it may progress and lead to complications such as skin changes, infections, and functional limitations. The physical therapist play a crucial role in the management of lymphedema through assessment, patient education, exercise prescription, compressed therapy, and long-term monitoring. Now onto the definition and classification. Lymphedema can be classified into two major types: primary lymphedema and secondary lymphedema. Primary lymphedema occurs due to congenital or hereditary abnormalities of the lymphatic system. In these individuals, lymph nodes or lymphatic vessels may be absent, underdeveloped, or malformed. One common abnormality is called the hypoplasia, where there are fewer lymphatic vessels than normal. An example of primary lymphedema is Milroy's disease, a hereditary condition present at birth. In secondary lymphedema is much more common and results from damage to previously normal lymphatic systems. Some causes include cancer treatment, radiation therapy, surgical removal of lymph nodes, trauma, infection, chronic venous insufficiency, and paralysis and prolonged immobility. In developing countries, cancer treatment is the most common cause, especially breast cancer treatment, involving lymph node removal. Worldwide, a parasitic infection called a filariasis is one of the leading causes of secondary lymphedema. Now, clinical presentation. Patients with lymphedema commonly presents with swelling in the affected limb or body region. The swelling usually occurs distal or to around the area where the lymphatic function has been impaired. Common signs and symptoms include persistent swelling, heaviness in the affected limb, tightness or pressure sensation, fatigue, reduced flexibility and mobility, numbness or tingling, discomfort ranging from mild to severe. In the early stages, the swelling is often a pitting edema, meaning a finger pressed into the skin leaves an indentation. As the disease progresses, fibrosis develops, causing the tissues to become harder and less compressible. Now, skin changes and complications. Long-standing lymphedema can cause significant skin changes. These include thickened skin, fibrosis, hyperkeratosis, papillomas, cyst, and lymph leakage. The skin also becomes more vulnerable to infections. Patients frequently experience cellulitis, fungal infections, and delayed wound healing. Repeated infections may further damage the lymphatic systems and worsen the healing. Swelling. Because of these complications, early detection and management are extremely important. Next is patient history. Obtaining a detailed history is essential when evaluating a patient with suspected lymphedema. Important information includes previous cancer diagnosis, radiation therapy, lymph node removal, surgery, trauma, chronic venous insufficiency, and family history of lymphedema. One interesting feature of lymphedema is that symptoms may not appear immediately. The condition can develop within weeks after injury to the lymphatic system, or it may take years, even decades, before swelling becomes noticeable. Therefore, healthcare professionals should closely monitor at-risk individuals. Now, assessment and diagnosis. Diagnosis is often made through clinical examination. A physical therapist would assess limb circumference, limb volume, skin condition, tissue texture, presence of pitting edema, and functional limitations. One important clinical sign is the steamer sign. The steamer sign is considered positive when the skin at the base of the toes or fingers cannot be lifted or pinched. A positive steamer sign strongly suggests lymphedema. Measurements of limb circumference are also used to compare the affected and unaffected limbs and monitor changes over time. In some cases, imaging tests such as lymphoscintigraphy may be used to evaluate lymphatic system functions.
Physical therapy management. The cornerstone of treatment is complete decongestive therapy, commonly known as CDT. CDT is considered the gold standard treatment of lymphedema. It consists of two phases. The first phase is intensive treatment and phase 2 self-management. Phase 1 intensive treatment. The goal is to reduce swelling and improvement lymphatic drainage. Components include skincare, manual lymphatic drain, compression, bandaging, and exercise. Skincare. Proper skin hygiene helps prevent infection and protection the skin from breakdown. Patients are taught to keep the skin clean, moisturize regularly, avoid cuts and burn, monitor for signs of infection. Manual lymphatic drainage. Manual lymphatic drainage or MLD is specialized message technique that encourage lymph fluid movement toward healthy lymphatic pathway. The treatment uses gentle rhythmic movement rather than deep pressure. Compression bandaging. Compression bandages help maintain the Maintain the reduction in swelling achieved through treatment. Compression must be carefully applied because excessive pressure can obstruct lymphatic flow and worsen the condition. Exercise. Exercise play a key role in promoting lymphatic circulation. Examples include walking, range of motion exercise, strengthening exercise, deep breathing exercise. Muscles contraction help move fluid through the lymphatic vessels. Importance of exercise. Importance of lymphatic exercises. Exercise is one of the most important components of lymphedema management because muscles contractions help pump lymph fluid through the lymphatic vessels and back into circulation. Unlike the heart and the lymphatic system does not have its own pump, instead it relies on muscles movement, breathing, and body activity to move lymph fluid. Regular exercise helps prevent fluid from accumulation in the affected limb and support the effect of compression therapy and the manual lymphatic drainage. Physical therapy prescribes exercise that are safe, gradual, and tailored to the patient condition. This may include range of motion exercise, stretching exercise, walking, and deep diaphragmatic breathing. Benefits of lymphatic exercise. The benefits of lymphatic exercise include improved lymphatic drainage, reduce of swelling and edema, improve joint mobility and flexibility, increase muscle strength and endurance, better circulation, reduce feeling of heaviness and tightness, improve functional independence in daily activities, enhance overall quality of life, reduce risk of complication and disease progression. Patients are encouraged to perform this exercise regularly while following their prescribed compression and self-management program.
Hey everyone, welcome back to my channel. My name is Kelly. I am a physical therapist and I specialize in lymphedema as well as oncology. And in this video today, I'm going to go through a 12-minute lymphatic drainage flow routine for the legs. This is for leg lymphedema or leg swelling or just general lymphatic health. These exercises will be done laying down either on the floor or they can be done in bed. We will be moving the legs around, but if someone needs a little bit more support for the back, they can also use a bolster like this one. This video is part of a series in collaboration with Lymphy Strong Move That Lymph group, which I will link down in the description below, and I encourage you to check out further. For the other videos of this series, you can check out the playlist up above and be sure to subscribe down below to see when the next videos come out. You can also follow along with us on Instagram for more information and related content. But let's get going. So all of these movements will be done for 45 seconds with 15 seconds of rest. I will educate about the next movement and give cues throughout for modifications. First, we're going to start laying down on our backs, and we're going to start with belly breaths. So placing the hand on the belly, take a nice big breath in, feel your belly expand, and relax. We're going to keep going through this breaths as our first exercise. Breath in and out. Keep going at your own pace. We always want to start by stimulating the lymph nodes that are in your abdomen, as there are a lot of them. All of the fluid through your legs have to go through the abdomen, through these lymph nodes, to then get out of the area. So we want to make sure that we're getting these areas stimulated. 10 more seconds of breathing. Good. And relax. Next, what we're going to do is we're going to do core and trunk rotation. So feet are on the ground, legs are bent, and we're going to go back and forth side to side. So let both legs fall over one way, and then come back to the middle, and then go the other way. You're going to go back and forth at your own pace. Make sure to keep your core somewhat engaged. You're not arching too far into your low back. We're just trying to get some stimulation of the core muscles. You are over halfway. Five seconds. And relax. So next what we're gonna do is we're gonna do leg circles. And so we wanna try to put the legs up in the air. If you can do both at the same time, that's great. Some people will have to do half and half. And what we're gonna do is do large circles. If that is too hard on the core and the back, we'll put one leg down and just do one leg at a time. And I'll let you know when to switch. You can go one direction and the other. And then if you are doing one leg, you go ahead and switch right now. Other leg up in the air and do circles. You can switch directions. Try to keep that low core engaged so your back is not arched up. And then relax. Next, what we're gonna do is a bridge. And so you're gonna have your feet underneath you, legs are bent, core is engaged. You have a little bit of pelvic tilt on. And then we're gonna end up lifting our hips up and down and relax and repetition with that. So when we're ready, going to lift your hips up, feel your glute squeeze and come down. And up and down. You want to make sure that you don't just arch into your low back to try to get higher. You really want to make sure you have your pelvic tilt. Just lift as far as your hips will let you and then come back down. Squeeze your hips to the top and control back down. If you do have any back pain, try not lifting as far. And again, remember to have that pelvic tilt on so your back is flat and just using your hips to lift. And relax. Next, what we're gonna do is we're going to march the leg up, kick it straight up, come back down, and then switch. So march up, kick, down, and down. Going back and forth for the 45 seconds. So march, kick, down, and down. March, kick, down, and down. Back and forth. Getting the thighs to pump and the lower legs to start pumping, but also working with gravity to get that fluid moving out of the legs. Making sure that your back is nice and flat to the mat and not arching up. You're under 10 seconds. And relax. Next, what we're gonna do is we're gonna do hamstring flossing or nerve glides. So we'll end up holding behind the knee if we can. And then what we're gonna do is you're gonna straighten the knee and back down. Okay, the other leg can be bent for back support or it can be straight, whatever's more comfortable. But we are beginning, so we're gonna do halfway and then we'll switch legs. So up and down. We want to try to hold the hip at about 90 degrees, so you don't need to hold really high. Okay, keep the arm straight, bend, and straighten the knee. Okay, and then we're going to go ahead and switch legs. Same thing on the other side. Straighten and bend. You will feel tension behind the thigh. That is what we call nerve tension usually. It also can be hamstring tightness, but either way, nice and gentle. This will get some good mobility, but also muscle pump for the lymphatics. And relax. Next, what we're gonna do is ankles. And so if you have, you're getting back's getting sore, your core is getting sore, instead of having your legs up and pumping your ankles, we can keep them down by your sides. But if you can, it'd be nice to get some gravity and have your ankles and your feet are in the air, and we're just gonna add ankle pumps. Again, if this gets to be too much, we'll just put them down on the ground, back stays flat, up on the toes, pull the ankles or the heels up and down. You can also do this with straight legs if needed, up and down with ankle pumps. Last 15 seconds. You can also do ankle circles if you want. We just want the ankles pumping. And relax. Good. Now that we've made our way all the way down, we're gonna make our way back up. We went from the top to the bottom to decongest the area, and now we're gonna work our way back up to get the fluid moving the rest of the way. So we're gonna go back to the hamstring. So we're gonna take one leg, hand behind, straighten the knee, and bend the knee, back and forth. Straighten and bend. And then what we're gonna do now is go ahead and put your leg down, other leg, switch, same thing. Straighten and bend, supporting behind the knee. If you have any knee pain with this, just don't go very high. Keep it nice and short, otherwise full range of motion if we can. The last 5 seconds. Good, and relax. We're gonna go back to the march and the kick, and so what we're gonna do, march, kick, down, and down. Going back and forth between the two sides, alternating, or you can do all on one side, switch halfway if you want, but I'm gonna go with alternating, so march up, kick, down, down. March, kick, down, down. Keep going. Again, check your back, make sure your back is nice and flat to the mat, not arching up. You are halfway, so if you are doing one leg at a time, you should be switching now. Otherwise, keep alternating. March, straighten, bend, down. March, straighten, bend, down. Last few seconds, and relax. Okay, we're gonna go back into the bridges, okay? Make sure you have your pelvic tilt, so we don't wanna arch back, we wanna have a flat back, keep that core engaged, and then we'll lift our hips up, off the mat, and back down. Make sure that you check your posture each time. So here we go, so pelvic tilt, lift, down, relax. So tilt, up, down. You are welcome to hold a little bit longer at the top if you want a little bit more strength, but we want to try to keep moving because we're working on muscle pump. That's what is utilized to help with the lymphatic pumps. As the muscle pumps, it gives some compression to help with the valves of the lymphatics. Nice easy pace, last 10 seconds. And relax. Good. We're going to go back to the leg circles. So again, if able to keep the core engaged and the back flat, we can do both legs at the same time. But for many, likely we'll end up doing just one leg at a time. So one leg in the air, other one bent, keep that back flat. We're just going to do nice large circles with the hip. If the back starts to come up, recheck, re-flatten it. I'm going to switch directions. And then go ahead and switch legs. If this is too challenging even to hold the leg up, this can be done lower or even on the bolster, like half supported by the knee, like we talked about before using the bolster. That would work as well. But as much gravity support as we can. Working the low core and the hip muscles, and relax. We're going to go back to the rotation of the trunk, and so letting the legs fall over one way, coming back, and then the other direction. So here we go, and go ahead and start. So go one way, back to the middle, and then the other way. Back and forth, nice and controlled. Still try to be aware of your back posture, not arching into the back, but rather having the core engaged and just using your oblique muscles, the side core muscles, back and forth. You are in your last 20 seconds before we are done. What we're going to do with our last little bit of rest in 3 seconds is to take 2 big belly breaths. So big breath in and out. Good, one more. Big breath in and out. And that's a simple 12-minute routine for leg swelling and lymphedema. Again, the major components are any sort of movement or muscle pump helps get the fluid moving up and out with the help of the valves. Along with that, we want as much elevation as possible so that gravity plays a role. And then if someone has compression garments or compression stockings, that's also great to have on during this time because the compression with the exercise and the elevation is going to be the best thing for the lymphatics. Again, if you want to see the other exercise videos I've created, feel free to check out the playlist, subscribe down below to see when the next one comes out, and I will see you all next week for another video. Thanks everyone. Hey everyone, welcome back to my channel. My name is Kelly. I am a physical therapist. I specialize in lymphedema as well as oncology. In today's video, we're going to talk about exercises for lymphedema of the legs. Exercise plays a really important role to help reduce swelling and lymphedema from the legs. So in today's video, I'm going to go through a 15-minute sitting routine that someone can follow along to for leg lymphedema and swelling. This video is part of a series in collaboration with Lymphy Strong Move That Lymph group, and I will place a link for that group down in my description below that you can check out further. So all you need now is a chair, maybe some water, and 15 minutes. Let's get started. We're going to go through a series of exercises starting from the trunk and the core, working our way down the legs to the feet and the ankles, and then working our way back up. So we're clearing a congested area and then pushing the fluid back up. Each movement's going to be done for 45 seconds with 15 seconds of rest, but feel free to move through those 15 seconds if you want more exercise. I will talk through each movement as well as modifications for all of them. So first one is going to be marching. Go ahead and get your knees up nice and high, trying to get as much range of motion as possible. Also want to make sure that we're sitting up nice and tall, not getting too slouched down, because we do use our core to hold ourselves up nice and tall. If we do need the back of the chair, that is just fine, but just make sure that you keep moving. If you want to add the arm swing in, that is also just fine. Last 10 seconds. Keep moving. Go ahead and relax. Next one we're going to do is side bend. So you can put your hands behind your head. We're going to tilt over one way, feeling a stretch on the side, back to the middle, and then the other way, going back and forth. So hands behind the head, tilt over and up, and over and up. Can get a little bit of a stretch if you want to hold a little longer, but make sure that you're taking nice breaths throughout as well. If you want a little bit more of a stretch, feel free to take your hand, grab the wrist, and pull up and over for a little stronger stretch. If someone has shoulder issues, they can also keep the arms by their sides and just tilting and leaning over without using the arms. Last 5 seconds. And then relax. Next one we're gonna do is taking your hand and either tapping your opposite knee or your opposite foot, depending on how you feel for range of motion. Just making sure that you don't feel like you're straining too far into the back of your leg. If you feel like you have to strain too far to tap the toes, then just take and tap the opposite knee, but try to get some trunk rotation with that and keeping yourself up nice and tall. Or you tap forward, but try to keep your chest up. Ten more seconds. Next, we're going to reach all the way up and then all the way down to the ground. So you can have your knees out to the sides or together if you prefer. Just make sure that you watch your back posture. So all the way up and down. If you need more of a stretch, you can reach out far in front of you or underneath the chair. All the way up and all the way down. If you have any issues with your back or reaching forward, just reach down to the mid shin or even just to below the knee. Just make sure all the way up, all the way down. Same if you have shoulder issues, maybe just tap your shoulders and then reach down to the ground. Last 10 seconds. And then relax. Next one we're going to do is rotation. So you can put your hands behind your head and we're going to rotate one way, back to the middle, and back to the other way, going back and forth. Middle, and then rotation. You want to make sure that you stay up nice and tall and stay within a pain-free range. If you want a little bit more of a stretch, you can put your arms straight out and rotate with straight arms, but making sure you feel that rotation in your midsection. Last 10 seconds. Good, and relax. Next we're going to do is step out to the side, and you can also add your arm out to the side as well. We're going to reach large motions out one way and large motions out the other way. We really want to make sure that we're trying to step straight out to the side rather than just turning our bodies. We want to make sure that we're trying to step. Scale the motion as you need to, but nice big motions. Last 10 seconds. And relax. Next, what we're going to do is we're going to do knee motion. So we're going to march our knee up a little bit, kick out, back, and down. So up, out, back, and down, and alternate between the two. Up, out, back, and down. Back and down. And you can go as fast or as slow as you'd like. Just making sure that we're getting full straightening of the knee and then a full bend as well. Still make sure that you're watching your trunk posture, sitting up nice and tall for your spine. Last few seconds. And relax. Last way, all the way down, we're going to the feet and the ankles. So we're going to go up on the toes and then pull the toes up, getting as much motion as we can. Here we go. Again, take your time with this. or speed up as you can. You can do one at a time or both, or find a beat to a music. You can also make sure that you're trying to curl your toes as you go up to get a little bit more toe motion. And if any of this bothers you, you also can sit there and do ankle circles in each direction back and forth. And relax. So now we've made our way all the way down, we're gonna come back in the other direction. So we're gonna go back to the up, out, back, and down, alternate between the two. Out, back, and down. Last 10 seconds. And relax. Okay, we're going back to the side steps. You can add that arm in. If that bothers you, just feel free to step. But we're gonna try to alternate. And again, make sure you're not rotating. Make sure you're trying to stay facing forward. So, step. And relax. Going back to the rotation, so hands behind the head, rotating back and forth, or open up nice and wide with your hands straight or your arms straight. Alternating between the two, make sure you stay up nice and tall. Open. Okay, we're going back to the forward lean and reaching. So placing legs apart or wide, making sure that you can round your back out if you need to, but keep it flat if you have any pain, and all the way up. Down. And relax. Okay, now we're going to opposite hand to opposite ankle or opposite foot or opposite knee, making sure that we're getting some rotation there, but also keeping ourselves nice and tall and alternating. Good. Okay, we're going back to side bends, working on the sides of the trunk. You can put your hands behind your head, leaning back and forth, arms by your side, or straight arms up and over, whatever feels good. Good. And we're going to finish up again with marching, making sure we're sitting up nice and tall, getting our knees as high as we can. Use the back of the chair as needed. And relax. So that's a nice seated 15-minute routine for lymphatic drainage and lymphatic flow for lower extremity swelling and lymphedema. If you want to see the other videos in this playlist, you can check out the playlist up above or subscribe to see when the next videos come out. I will see you all next week for another video. Thanks everyone.
Phase 2. Self-management. Once swelling is reduced, patient enter the maintenance phase. These include wearing compression garments, continued exercise program, ongoing skincare, self-monitoring, periodic follows up visit. The goal is to prevent recurrence and maintaining long-term result. Clinical case examples. Case 1. Breast cancer survivor. A 55-year-old woman underwent breast cancer surgery with lymph node removal. Several months later, she developed swelling in her left arm. Functional limitations: difficulty lifting objects, difficulty dressing, reduced arm mobility. Intervention: manual lymphatic drainage, compression sleeve, and therapeutic exercises. Expected outcomes: reduce swelling, improve arm function, and better quality of life. Case 2. Chronic venous insufficiency. A 65-year-old patient with chronic venous insufficiency develops persistent swelling in both lower extremities. Functional limitations: difficulty walking, leg heaviness, and reduced endurance. Intervention: compression therapy, exercise program, and skincare education. Expected outcomes: improve mobility, reduce edema, and prevention of complications. Case 3. Filariasis-related lymphedema. A patient living in a tropical region develops severe lower extremity swelling due to filariasis. Functional limitations: difficulty walking, difficulty performing daily activities, and social participation restrictions. Intervention: compression therapy, skincare, exercise, and patient education. Expected outcomes: improve function, reduce swelling, enhance independence. Importance of early intervention:
Research shows that early identification and treatment lead to better outcomes. If detected early, lymphedema progression can be slowed and complication can be minimized. Physical therapies play a critical role in screening high-risk individuals, educating patients, monitoring symptoms, and implementing appropriate intervention. Early management improves mobility, comfort, participation, and overall quality of life. Conclusion. To conclude, lymphedema is a chronic condition caused by impaired lymphatic drainage, leading to the accumulation of lymph fluid and swelling in affected body regions. It may be classified as primary or secondary and can result from congenital abnormalities, cancer treatment, trauma, infection, or other conditions affecting the lymphatic system. Common manifestations include swelling, heaviness, discomfort, reduced mobility, skin changes, and an increased risk of infection. Early recognition and intervention are essential to prevent progression and improve long-term outcomes. Physical therapies play a vital role in the management of lymphedema through assessment, patient education, complete decongestive therapy, compression therapy, manual lymphatic drainage, and therapeutic exercises. Lymphatic exercises are especially important because they promote lymph flow, reduce swelling, improve mobility, and help patients maintain independence in their daily activities. With proper treatment, consistent self-management, and ongoing rehabilitation, individuals with lymphedema can achieve better function, improve quality of life, and greater participation in work, family, and community activities. Thank you for listening.